Welcome back. COVID-19 cases are cautiously on the decline in the U.S., but experts are warning about us being too complacent. So what do we need to do to avoid a second wave of this or a surge? We'll tell you what doctors are learning about the coronavirus survivors who are still feeling the effects months later. Dr. Nicholas Testa, Chief Medical Officer for Dignity Southern California, joins us now to discuss some of this stuff. And good morning to you, Dr. Testa.
Good morning, Phil.
Well, first off, let's talk about complacency. Our COVID cases around the country are decreasing, but we're not out of danger, right? What should we do?
Well, actually, Phil, let me correct you on that. If you look, the COVID numbers actually are slightly increasing right now. So
okay.
I tend to follow our 7-day average. And what we're seeing in Los Angeles is, on a 7-day average, about 1,000 new cases a day. That's up from 900 new cases just a few weeks ago. Across the country, we're up to 42,000 cases a day, up from 35,000. So we're actually on a little bit of a surge upwards right now. Now, it's not a spike, but it's definitely going up a little bit.
Well, now, what about the mortality cases? I mean, if we have more cases, but our death rate remains lower, I mean, is that creeping up as well?
So the death rate has been about the same. So we haven't seen the number of fatalities go up yet, but that usually lags a little bit behind. And remember, the numbers are going up just slightly. So this is not totally unexpected after Labor Day, but it's just a reminder to all of us that we aren't out of this, okay? And that this is going to be that light switch or that dimmer switch that we talked about. It's going to go up and it's going to go down until we have some sort of definitive treatment to manage it.
Okay, we want to talk about hot spots across the U.S. or maybe cities seeing a higher increase in cases. And I want to ask if you think that colleges may have anything to do with that, because while kids aren't necessarily on campus, they're certainly, in many cases, in apartments in the cities.
Yeah, so the areas where we're seeing hotspots are mostly in the middle of the country. South Dakota, North Dakota, Utah, Wyoming, Oklahoma, we're seeing hotspots. I don't think it is much related to colleges, as I think it's related to areas that were not as significantly hit on the first round. Oh. So we're really seeing the bloom of COVID in those locations.
And this is such a disease. It's a disease we didn't know anything about a year ago, and now we've had millions of COVID survivors around the country. Are we learning anything about long-term effect? I know it's not really long-term yet because it's been so new, but what are we learning from people who survived?
The first thing is that we're learning is that the vast majority of people recover and have no long-term sequelae that we can see so far. We are seeing a subpopulation of complications, mostly in the older patients as well as in those with comorbidities. And the most general thing we see is complaints like fatigue, persistent cough, shortness of breath, headaches, some generalized complaints. I think the most interesting complication that we've seen is this hypercoagulable state where people are developing blood clots, which can result in heart attack, stroke, or myocardial infarction, or a pulmonary embolism. So that's right now the most interesting complication that we're seeing.
And we hope people get that treated very quickly. Dr. Testa, thank you very much. So much to learn about this disease as we move forward. And again, we want to advise everybody to just stay the course. Come so far at this point. So thanks again for joining us. Hope you have a great weekend.
Thank you, Phil.